let's talk about sleep lines. So this is my rubber model. This is Mona. And we're going to talk about how we assess sleep lines on our patients. So when you're assessing someone's wrinkles, you want to look out for sleep lines. So the most common places for sleep lines are going to be on the eyebrow, going about this way, going vertically. So we have the horizontal lines caused by the frontalis muscle, but a sleep line usually comes this way. Then you also see some of them coming down this way. They look a little bit deeper than crow's feet. When you have them smile, you don't see those lines being made, so it's not due to the contraction of the oculi muscle. Sometimes you'll see one going laterally this way. Sometimes you'll see one going this way too. So if you were to smush Mona's face, you can kind of see where that line would lie. You also see them here on the medial cheek. So if you were to squeeze that, you can see where there might be a line right there. And there could be some going this way. So they look like little parentheses surrounding the mouth. So the best way to tell is just sort of squeeze the patient's face together like that and squeeze the skin, and you can see where they lie. Sometimes these marionette lines can actually be due to sleep and not necessarily volume loss. So look for that. If you have a patient with a fuller lip and a full cheek, if you squeeze just like that, that can also be a sleep line. And sometimes they have it symmetrically on both sides of the face, but sometimes they favor one side. So make sure you're pointing those out to patients. Make sure that you are taking photographs. The sleep lines can become more apparent after the toxin has kicked in because the rest of the face sort of smooths out and those sleep lines become more apparent. So take photos, point them out. Best way to treat those are collagen stimulating treatments and to use silicone patches at nighttime. They usually have a 30-day supply or a 30-day use where they can be stuck on the areas where you're seeing those sleep lines. You usually can't use products along with them. Usually it just has to be applied to dry skin, but they can be applied around the eye area. They can be applied around the mouth area. You can also find one for the décolleté.